And today we have invited Beau Hein to speak on basic counseling skills. This training series is brought to you by the National American Indian and Alaska Native Addiction Technology Transfer Center, or ATTC. We are one of 4 national focus centers serving the ATTC network, which also includes 10 regional centers and a network coordinating office. To learn more, please visit our website. This series is designed to be a broad overview to assist in preparing for written alcohol and drug certification examinations, to enhance existing knowledge, and to improve overall competence and treatment outcomes. Please be aware that this series is not meant to stand alone, and previous education and training is necessary in order to pass alcohol and drug certification exams. We recommend that if you are preparing for an exam, that you seek additional preparatory help and let this course be one of many tools you use to prepare. Our next session in this series will be February 18, when Matt Ignacio will present group counseling. We also offer the American Indian and Alaskan Behavioral Health webinar series, and we'll welcome Brent Learman on February 4th to present the American Indian and Alaskan Native Leader Academy, Empowering the Next Generation. For more information on our web series, you can contact me at the email address or phone number provided on this slide. Our center is a NADAC certified educational provider, and we'd be happy to do with CEHs for a $15 fee. The CEH request form is available for download in the Files pod in the webinar screen. We will also be sending this form and a follow-up who attended. Immediately following today's webinar, we redirected to GPRA evaluation. GPRA stands for the Government Performance Results Act, and SAMHSA asks to evaluate our events in order to comply with this act and provide a performance assessment and accountability. This survey asks about your satisfaction with the event and will take less than 10 minutes to complete. We thank you in advance for helping improve our programs. If you've never used the Adobe Connect system before, you may view the presentation in full screen mode by clicking on the full screen button in the top right corner of the presentation pod, which looks like 4 arrows. To return to the regular view, button again. On that note, I just wanted to mention we'll be doing a number of multiple choice poll questions throughout today's webinar. So in order to take part in those poll questions, you will have to exit the full screen mode so that and respond to those poll questions. So keep that in mind. To share your questions and comments, and we will address questions at appropriate points during the presentation. We would also like you to be aware that this webinar records participant attention time. If you minimize the webinar or are working in a window, the system will record your participation as inactive, which may be reflected in the number of seats received. Today's speaker is Beau Hein. She is actually a consultant for the National American Indian and Alaska Native ATTC, and is one of the master trainers providing training for the American Indian curriculum for state-accredited non-tribal substance abuse programs in South Dakota. She is also employed with the South Dakota School of Mines and Technology in Rapid City, and is a mentor to the Native American students receiving a scholarship within the Tioshpaye program by the National Science Foundation. Counseling background, cultural awareness, and academic experience complement the scholarship program's objective to ensure students succeed in their academic goals to graduate with a degree in science, technology, engineering, or mathematics. She's also has extensive experience in the addictions field, and welcome her today to instruct us on basic counseling skills. So I will handing things over to you now at this time, Dee. Thanks so much.
Good morning. I want to welcome everybody to our basic counseling skills presentation. We've got quite a bit of material to review today. We've got it broken down into five areas. We've got goals and objectives in each area, counselor development, micro-counseling skills. And as we move through, we're going to get a little bit in depth in a lot of these, and in some of these is where those poll questions are going to come into play. Counselor development, typically with any kind of development, you're doing a step process. So in developing your skills, is going to be require different levels of steps. And for some of you that may have been in the field for a while, you've already come through some of this. For some of you, you might be getting refresher course areas to consider, enhance on some of your skills and such. So I think you'll appreciate the material that we've got for you. Process of thinking and reasoning, we're looking at two different approaches to thinking, global and linear. In global thinking, the process is a little different, where most people that are global thinkers think of things as a whole. They're not ones to think of things segmented. Global thinkers are typically ones that tend to see the whole picture. They don't skip steps. They like to set up categories so everything can be included. They like to see things. I mean, they're ones that they're visual. They're very much visual people. Whereas linear thinkers are ones that they have trouble working in visual clutter. They have to have everything organized. They're more concerned with detail. Linear thinkers have a starting point and an end point. The significant difference between the two, circular and linear, are the conclusion is contained in a single creative assumption, whereas linear thinkers, the conclusion is derived from multiple assumptions. And you'll get a little bit more understanding of this as we move along. It's really important to identify the learning process and how you typically learn. Most of us can pull something out of each of these areas: visual, auditory, and kinesthetic. But for most of us, we'll tend to follow one area a little bit stronger than another area. Visual learners typically like demonstrations. They're ones that like flashcards, color coding. They have to actually see things to where it absorbs and it makes sense. Auditory, oral instructions, auditory tapes. You might be one that like to drive down the road and listen to books on tape, and you get more information that way. Kinesthetic are folks that have to do the learning process. If you're able to identify which area this is going to help in the counseling, and because it's going to help you be able to absorb the material that you need to learn, enhance your skills, and then identify your clients or consumers, and how you're going to relay that information that's going to best suit them. Global linear thinkers, this is a little activity for you to think about. How do you process information presented to you? When you go to trainings, this, for instance, is it easier to see it visually? Would it have been better to have me standing in front of you with the personal connection to see, my hands waving all over the place? Or who in your life do you believe processes information on the other end of the scale from you? How do you adjust your communication when speaking with a person who processes differently than you? And you can kind of tell when you're working with somebody or talking to somebody if they're getting what you're telling them or not. And some of you might say, "Here, let me show you." And they're like, "Oh, now I get it," and those are visual learners, something like that. So how do you feel that you learn best? And this is really going to be an important question for you to answer as you move through your counseling skills. So here's our first poll. As Kate said, you have to come out of your full screen. Let me see if I can get in there, get out of the full screen here, and then answer the which one do you identify with. And like I said earlier, most of you can identify with more than one. And for when we get into the cultural area of the training, you're going to see most of our native people are auditory and visual learners. So, okay. Looks like we're back on session, and I can review the answers to what type of learner you are. And I see a large portion of people are answering a mixture of two, which is fine. Like I said, as you move through your counseling skills, you're going to find that you will use you tend to use more of one more than the other. So yeah, that works. Does anybody have any comments or questions they want to share on this?
And feel free to send those comments and questions to into the Q&A just below the poll question area there. I don't see any other questions. I think we can probably
Okay. Okay, we're going to look at the integrated developmental model in this material. This is really an interesting model to consider. It helps with supervision of counselors and therapists. It's got a number of domains, and in this area, we're gonna look at the steps that you go through. Now let's see if I can get into the next screen. It's not letting me move.
Try clicking on, click right on the screen once and then hit the forward arrow, and then you should be able to use your arrow keys.
Do which one? Oh, the forward over here. Okay. Gotcha. Okay. So in the counselors, like I said, we do that. We develop in a step-by-step approach. Counselors are seen to move through 3 levels of development, and you all are going to find yourself in one of these areas. In the integrated developmental model, people are continuously growing, and growth is not linear but sporadic, and that's important to note. Growth can be affected by changes such as caseload, treatment setting, supervisory relationship, and population served. And I found this to be very true when I got into the field. I did find when I had a smaller caseload, but as I got more confident in my counseling skills, my caseload grew, and I was working with a more diverse group of clients. And the treatment setting, changing treatment settings, sometimes the climate and the culture and the treatment program is a little bit different, and you learn how to adjust to that. And you learn more in that process as well. So there is some changes that can affect growth as you're moving through your counseling experience. So some of the levels that they're talking about are the beginning, intermediate, and advanced. Overriding structures, self and other awareness, and these are things to be mindful of. Motivation, autonomy. As you're growing as a counselor, what stages you're at as a counselor, and all 3 of these overriding structures affect each one of these levels of counseling. The integrated development model talks about 8 growth areas. Now, in these 8 growth areas, intervention skills, competence, you're going to fine-tune each one of these areas as you're moving through your counseling experience. Some of you might have come to some of these naturally. I mean, they might just come naturally for you, and it's easy for you to do some more than the others. Intervention skills, competence, learning the skills to be able to intervene in certain types of circumstances with certain types of clients. So it really is going to make a difference of where your skills are at here and how you're going to grow in that area, because you could be working with mental health, dual diagnosis clients. You can be working with just a substance abuse issue. So it really kind of depends on where you're at and where they're at in their treatment experience. Assessment techniques You're probably going to get trained in your organization or your program on some of these techniques, but again, some of these are to get a little bit closer to the client. And we're going to go through some of these a little bit more in depth as we move. When you're looking at the level of counselor development, like I said, beginning, intermediate, and advanced, level 1 counselors are full of trust and hope, and this is pretty typical what you're going to find in the field. Level 2 confusion stage, and this is from as you're going in more material and you're learning more techniques and you're being exposed to a different diverse clientele. You're looking to strive for independence, less imitative. We typically find somebody that in our counseling experience we really admire their approach to counseling, so we might try to model some of their behavior or model some of their techniques. And sometimes we can get frozen in some of the attitudes and become ambivalent in instability, and that will hinder our growth. So in level 2, that might be some of the confusion stage that one may go through. When we get to level 3, we kind of get our footing, where there's a calm after the storm, so to speak, and we're able to concentrate and demonstrate development in learning. And learning, as you all know, is a life experience. My counseling skills is this picture really illustrates this well. Counseling help. The counselor is inundated. As you start honing in on your counseling skills, you're going to find that there's a lot of area for growth, and it's ongoing. There's always areas for growth. Alan Ivey is the person that developed these approach to micro-counseling skills. He's the originator of the approach. Intentional in counseling, he's responsible for that as well. Essentials of intentional interviewing. These are some areas if you're interested to follow through with some more information to help you develop your skills. Micro-counseling is an analysis of counseling skills that look carefully and in great detail at the elements of the counseling relationship. So when you're beginning your counseling experience, it's really going to depend on where you're at personally, but also how you develop that relationship with the client. Regardless of the aims and methods of a counseling relationship, understanding its micro elements helps counselors improve their counseling effectiveness. One area that he talks about is called attending. In attending, counselors' interest in the client demonstrated by eye contact, body posture, and accurate verbal following. Attending has a lot to do with the nonverbals and the verbal interaction. It encourages clients talking, active listening. Those are going to be really important to pay attention to, and how you grow in these different areas. Learning how to ask open-ended questions, and as opposed to closed questions. This is a big area that I learned personally early on in my counseling experience, where I would get a little nervous if the client wasn't talking, so I would be asking, and I found that I was asking closed-ended questions. I wasn't allowing them to elaborate anymore in their answers to me. So when I learned how to ask open-ended questions, it changed our dialogue. I was able to get a lot more feedback from the client. Open-ended questions, you might want to consider. How may I help you? Use this information I'm giving you. Tell me how the problem came to be, how you came to be in the situation, or you're leaving it open for them to give you a little bit more dialogue and answers. Whereas a closed-ended question sounds more like, can I help you? And those are basically yes or no answers. Can you give me more information? And they could say, yes, I can, but will I? And that really depends on your interaction and, again, how you're working with clients. So it's important to understand the difference between these two and how you open up dialogue with your clients and where you're going to go with those questions. And hopefully you can set a dialogue where they'll be able to share more information with you so you can help. Reflective listening. This is really, really a big area in counseling, client observation skills, because most clients will say one thing, but their body language will say another. And it's really important for you to be able to cue into that. Nonverbal behavior, 85% of communication, and that's really probably pretty accurate. Verbal behavior, keywords, you have to pay attention to certain words that some of your clients are communicating, and understanding the discrepancies in the client's communications, giving you mixed messages, contradicting what they're saying. There's conflicts, so there's no inconsistency. There's no consistency. So as you grow and as you start working with more clients and you start interacting, you're gonna start noticing different body language when they're saying one thing and doing another, or as you're asking questions, you can see where they're shutting down, or you might, as you're learning how to reflect some of those questions back to them, you're going to find if you're on task or not with what you're hearing from them. So the task is not to problem solve, but to understand where the client is coming from, and that's really the key to reflective listening. And in reflective listening, we're encouraging, we're paraphrasing, and summarizing. And a lot of times when we're encouraging a client, it took a lot of courage for you to come in here and to share your story. It sounds like what I'm hearing is, you've had a difficult time at home with your family, or so what it sounds like, or what I'm hearing is, summarizing everything that they just told you and kind of what you just heard. And they'll tell you, the clients will tell you if you're on task or not. They'll say, yes, exactly, or, no, that's not what I meant, or, something like that. So that's going to really cue you in on whether, reflective listening is helpful or not. If you're doing it appropriately, the clients usually will let you know pretty quick. So, but these are the three areas that you want to pay attention to: reflective listening, be encouraging and paraphrasing and summarizing. Reflecting feelings, the client's either stated or implied as expressed by the counselors. So it's really important that you pay attention to that. You seem really uncomfortable, or is this an uncomfortable conversation for you, or you seem really angry right now, and would that be fair to say? And clients will tell you, typically, what they're feeling, and maybe some don't even know how to identify those feelings. They know the basic feelings as happy, mad, sad, and glad, and they don't know how to express disappointment or discouragement or shame, or things like that. So it's really important that you're paying attention to what they're feeling, and you're reflecting that with them, and not assuming that they're feeling something, but trying to get in sync with them on what they're sharing with you. Feelings of clients can be nonverbal and they can be verbal. So you can tell when a client's agitated. Typically they're going to shake their foot or tap their finger, or so that they're uncomfortable or they're uneasy, or those feelings will present themselves. And some will just flat out tell you, what they're feeling. I'm not happy, or I'm depressed, or whatever their feelings are. So you have something to work with. But it's really important that you're able to reflect those feelings back to the client, and as you're working with them. Reflecting meaning, finding that deeply held thoughts and feelings underlying their life experience. Paraphrase is to thoughts as reflection is to feelings. Break down complex barriers into parts. So I would, when I would work with a client, I didn't hesitate to take notes. And I would tell them up front, that I'm going to be taking notes here, so I don't, things that jump out at me, so I can remember to come back and visit with you those later in our session, or whatever, if I have questions. So I let them know right up front what I was doing and why I was doing it, so they understood that. Some people get uncomfortable with that, but if they understood what you're using those for, most clients are okay with that. So that's just for you as a counselor, to help you work with those feelings or those thoughts or whatever they're sharing with you. Understanding what the client is experiencing, putting oneself in the client's place. Empathy is really a big deal. Clients can tell right away if you care or not, or if they're just a number or a statistic and they're just pushing them through, like a number. They'll pick up on that real quick. Clients will also pick up on whether your heart's in the right place and you're really sincerely there to help them. But you be careful with that, and we'll get into that later on here in the material. So functions of empathy: build a relationship with the client, and it enables the counselor to better understand clients' behavior. If you and clients have told me this a number of times, I've been to treatment and I worked with my counselor, never had a addiction issue. How could they understand my addiction if they've never had it, if they've never went through it themselves? That's always a given. Or you'll hear clients say, well, they don't have family issues. They came from a happy family and they don't know what I'm going through, and things like that. So it's really important that as you share your empathy with a client, that that you give them a clear picture that you're really understanding what they're going through. I may not have had that experience, but I've had something similar, and I understand the feeling of disappointment or something like that. And then the clients say, well, at least they get that, and they'll connect with you a little better. Common problems with conveying empathy: language and cultural differences between clients and counselor. And as you see, if you've reviewed this, we're going to get into some of the cultural differences in counseling. And language can be a barrier, and those cultural differences can be a barrier, but they're achievable. You can get through them with the clients, because addiction, as we all know, knows no color, knows no gender, will affect anybody and everybody that is involved in the addiction. So that's something that is common. When I worked at a program, that's one of the things that my clients used to ask me about, is, well, they never used this or they never used that. How could they understand, what we're going through? And it's like, well, addiction is addiction, and everybody that is afflicted with this, they're going to come to recovery, using some of the same methods. So there's a common ground that you'll find in this. So here we got a poll question. Which of the micro skills has the most challenge for you? Attending behavior, open versus closed questions. I tried to give you some examples of that. Reflective listening, and empathy. So hopefully I gave you some good examples that you're able to, answer this in a good way. But and like I said, this gives you an idea of areas that you can work on yourself, areas that you want more information on, or areas that you're really strong in that you can maybe help your colleagues with, things like that. So it's important to kind of identify what area you're at with the micro skills in counseling. So from what I can see, open and versus closed questions is a challenge, and it is a challenge, because you don't want to dominate the session with your client. You want them to do most of the talking and you're doing most of the listening. Is really the ideal session, where you're getting the information and they're open and comfortable with you, or they're able to share that information with you. That's good. That's good to know that open and versus closed questions is one that is something that you want to work on. Is there any questions this far on this area in micro skills? Anything I can help you with or clarify or anything? I'll give you a few minutes, just a minute or so to think about it, and if you want to ask a question, Kate can put it in there for you, or we can get it answered for you.
Yeah, go ahead and submit your questions in the Q&A chat box. You should see the, if you haven't seen it, it's just below the poll question, and the spot where you have to type is actually at the very bottom of that Q&A. So go ahead and type in any questions there.
Okay, well, it looks like, well, we got a question. I'm sorry.
Yep. I'll go ahead and read the question out loud so everyone can hear. Elshana asks, I have a question on the reflective listening piece. Would validation play a role there, or is that completely different?
Validation is a big part of that reflective listening, because it's giving the client the understanding that you've heard what they said, and they will validate what you're telling them, what you're giving back to them is accurate or not. So that is a big piece of that. Yes, that's a good question. Does that answer your question?
She wrote, yes, it does. Thank you.
Okay, anybody else? Okay, why don't we go ahead and get moving then? We'll get started on the next piece.
Great.
Okay, here we're going to look at counseling perspective, and we're going to look at a lot of theories. For those of you that might be trainees and looking in the counseling as a counselor trainee, and if you're getting ready to certify, these are some of the things that you're going to want to do some research and study on, because there's a number of techniques and styles of counseling, approaches to counseling that are important to understand as you're moving through your counseling experience. So the first area is psychoanalytic perspective. Now, you're going to see as we move through this how counseling theories have evolved. As the more people in the field are learning what's working and what's not working via research, and things like that, you're going to see how it's changing how it has changed through the years. So psychoanalytical perspective consists largely of using methods to bring out the unconscious. So working through the past, transference relationships, focuses on childhood experiences, and training is required beyond the scope of most counselors. An advanced degree in psychology or psychiatry is necessary, and for those of you that are maybe taking courses, you're understanding that you're doing this right now. You're probably required to take some psychology courses and such. So, and you're going to see how that's helpful. Sigmund Freud is the main guru, psychoanalytical guru in the field. He's one that came up with the three elements of, if you recall, the id. We all have the id, the ego, and the superego. His dynamics of the unconscious and its influence. The looking at the pleasure principle, the reality principle, and the ego ideal. He's really keyed into the unconscious, and that's probably the most important thing with this with Sigmund Freud. The next person that you want to be mindful of is Erickson. Erickson broadened the developmental perspective beyond early childhood. He went a step further. He looks at establishing balance between ourselves and our social world. And these perspectives are important to understand because most of us as counselors, we tend to gravitate to certain types of perspectives in our counseling approach. And these theories are the basis for our approach. So there's a lot of material that we're going to go through here, but you're going to connect to one or more of these, and you're going to find that this is going to be helpful in your counseling skills, developing your counseling skills. Erickson talks about crisis is equivalent to a turning point. So when a person experiences that, they're looking like something's got to change in my life. Erickson perceived personality stages. He looks at, if you remember your teachings on this, he talks about hopes versus trust, or trust versus mistrust. He's got a will, what are will, autonomy versus shout. These go through the different ages, like this is from 2 to 4, 4 to 5, initiative versus guilt, to 12, industry versus inferiority, to the latter part of wisdom, ego, integrity versus despair. And he gets into more in depth in those different personality stages. So you'll learn, if you want more information on that, I would encourage you to research him. Carl Jung, psychological aspect of personality development during midlife, views humans positively. Innately, all humans are inherently good people. Spiritual approach, the meaning of life. Now, keeping in mind when treatment originated, most people in the field looked at the psychological aspect of it and the physical. So the psychosocial are the physiological aspects of addiction. Well, here Carl Jung is looking at the spiritual approach and the meaning of life, and that's the first time it's being introduced or even being looked at. The constant development, growth, and moving toward a balanced and complete level of development. Carl Jung was a humanistic psychologist. He was one. Oh no, I'm sorry. He was one that was constant and about development, growth, and moving towards the balance. So that was new when he came into the field with that. But some of the limitations of psychoanalytic perspective is a lack of ego strength needed for change. Great responsibility was placed on parenting, the mothers. If you look at the parental relationship, and you might see some older counselors working a lot with how was your relationship with your mother, how was your relationship with your father, and how did that affect their childhood and growing up, and then the cost that was involved in it. So those were some of the limitations. The contributions, conceptual framework for looking at behavior. There's past experiences may pertain to the current life. Role of early childhood development. It's important to look at those areas. So these were just some of the things that contributed to psychoanalytic perspective. Now we have Adlerian perspective. Alfred Adler, he came onto the field, and his goal was to help clients identify and change their mistaken beliefs about life and thus participate more fully in a social world. People need to understand and comfort basic mistakes, and family is an important factor. Cooperative therapy between clinician and client, and that's operative word is cooperative in the therapy. Sometimes you don't have that, and it just it makes it harder to get any productivity in the counseling experience for the client. His limitations in his perspective were difficult to empirically validate, so there was no scientific evidence to validate what he was alleging was happening. detailed exploration of early childhood, early memories, and dynamics within the family. Those were some of the limitations that his perspective presented, but the contributions to this perspective is working out an action plan to make changes in life. People are social, goal-seeking decision makers, sensitive to cultural and gender issues. So those are some of the contributions with this perspective. And then, as you're going to notice, we're moving into some more. Here we're introducing social aspects of a client's issues, where that wasn't an issue with Freud, or it wasn't an issue with Erickson. Now we have existential perspective. Viktor Frankl and Rollo May, these two are key in this theory. We are what we choose to be. And here we're introduced to self-awareness in therapy. So the client is becoming and is being allowed, in again through those micro counseling skills, the client is becoming more aware of their own self in the process of their therapy, and they learn that by you're working with them. So a process of searching for the value and meaning in life. People are faced with the anxiety of choosing to create an identity in a world that lacks the meaning. Self-awareness in therapy, process of searching for the value of meaning of life, the individual worldview, and so these were some of the areas that they were instrumental in researching, and this was their approach. So these were some of the limitations and contributions. I think some of the contributions is where I left off. The person is the central focus, so emphasis on the human quality of the therapeutic relationship. So again, now if you notice, again, we were in the beginning, it was psychological, physical, and now spirituality was kind of introduced there for a little, and now his or her life by choosing awareness. So self-awareness played a big part in this perspective. Now here's Carl Rogers' approach, and some of you may be more familiar with this because this is a little bit more utilized more, I should say, in the counseling field. Person-centered perspective, and Carl Rogers, he believed that the therapist's role is to be rather than to do something. So it focuses on the person, and it really puts the person as client-centered. Each of us has within us by nature a potential that we can actualize and through which we can find meaning. So it's initiating innate striving for self-actualization, and that's really the center for his perspective. Some of the limitations: therapists tend to be supportive without being challenging, and clients need to be challenged. They need to really consider where they're at in their life with their where they're at with their addictions or what they're facing. They really need to be challenged, because you can have some that where the therapist is doing all the work, and that's not a good place to be. So I can see this limitation causing a problem with the client-counselor relationship. Limited techniques, attending and reflecting is typically all you're going to see here. Therapist training, more emphasis on the attitudes of the counselor. All individuals may not have within them a growth potential or ability to trust their own inner directions. So those are some of the limitations of the person-centered perspective. But the contributions: stated concepts are testable hypothesis and was submitted to research. So this was researched, and they have scientific data that support that this particular perspective does work. And it's non-directive counseling is one of the contributions. Now we have Gestalt perspective. Fritz Perls. He based on the premise that people must find their own way in life and accept personal responsibility if they hope to achieve maturity. Therapists do not aim to change their clients, rather assist, and that's a big part of the Gestalt perspective. Is the client is experiencing all their feelings, avoid, interpret, and focus on client's behavior techniques. So there's a lot of client to make the necessary changes for their healing process. Some of the limitations for the Gestalt perspective is it's not for all clients. Dangerous as a result of the therapist's power to manipulate the client through techniques, de-emphasizes of the cognitions, so the thinking process. So it limits the approach to working with clients. The contribution is its action approach, so it really puts it on the client. They're, again, being motivated to make changes based on their self relationship. And it's also really important in group therapy. So for those of you that are going to go on and take group therapy or do groups, verbal and nonverbals is a big part of it while working with groups. Contribution is a compassionate confrontation. You know, some can be, some counselors in the older approach felt that confrontation was effective for some clients, or they responded well to that, and some didn't. And the adult's perspective is compassionate confrontation worked best. Perspective on growth and enhancement. And then we have control reality perspective. William Glasser, he rejects the medical model where there's physiological reasons why people are addicted, and he has his own approach and understanding of where clients are at. Believes live in an external and internal world. Counselors function as a teacher or a model, that changes the relationship based on that approach or that theory as looking at a counselor in that capacity. Focuses on personal responsibility and gaining control, and focuses on the full total behavior. So clients have psychological needs for belonging. They have psychological needs for power, freedom, and fun. So he really gets into that reality aspect of that. And in this approach, the limitations doesn't take into account the unconscious. It's all about the here and now, what's happening right now. The vulnerable to the contributions, on the other hand, short-term focus dealing with conscious behavior. So the contract approach, punishment and blaming is a basic reality. So psychosis can be related to unfulfilled needs. So he really gets into like I said, the immediacy of the here and now, what's going on right now in a person's life, and where they're at, how the choices they've made, and the results, consequences of those choices, the reality of that. And so this is that I've seen incorporated when working with more so with youth, and it seems to work in certain cases with that. Then the behavior perspective, Arnold Lattis, his interplay between individual and environment, and this is basic methods, so this is research based, where there's a lot of data developed, and you can go back and numbers and see how this is more productive in that respect if you're looking for scientific data. Therapist summarization, reflection, clarification, and open-ended questioning. The therapy is a collaborative partnership, and there's 3 major areas of development that he talks about. Let's see if I have any notes on that. No. Okay. Some of the limitations of this behavior perspective, it changes behaviors but doesn't change feelings. And feelings and behaviors work together, and as a counselor, you have to be aware of both. Ignores importance of relational factors, does not provide insight, involves control and manipulation by the therapist. The contributions of behavior perspective is cognitive factors and subjective reactions of people to the environment, systematic behavioral techniques, and ethical accountability. And like I said, a lot of these theories and approaches you're going to learn, if you haven't already, through your academic studies in maybe alcohol and drug abuse or whatever, if you're looking to get certified in the field. And they go a lot more in depth and give you a lot more examples of how these perspectives really work. Then we have the cognitive behavior perspective. Ellis, Eric, these may be familiar. BT, emotive behavior. We're seeing a little bit more of that in the now more so than before. Thinking, judging, deciding, and doing. Emotions stem mainly from beliefs, evaluations, interpretations, and reactions to life situations. And again, there's a lot of self-awareness going on in this approach. It challenges the belief system. Clients need to assume an active role, so they're more a part of. They're doing more of the work than the counselor is, and that's as works well for most. Psychological distress is largely a function of disturbances in cognitive processes, so it really examines a lot of the thinking process in addition to the behavior and then the feelings that are associated with that. And here are some of the limitations. Personal warmth is not essential effective therapy. There's some transference going on. Less concerned with unconscious factors and ego defenses. And when talking about transference, that's really an unconscious redirection of feelings from one person to another. And an example might be where the client is dependent on the counselor for a lot of the therapeutic work that they're doing. And that's not always helpful or healthy for either the counselor or the client. And a limitation is conversational therapy, advantages and disadvantages in that. Some people respond really well to confrontational therapy and some don't. But the contributions for this is self-responsibility in maintaining self-destructive ideas and attitudes, teaches clients to carry on their own therapy. So it really, it is comprehensive and eclectic in that it uses a number of other therapeutic approaches in the therapeutic practice. Family system. This is fairly new, and some of the names here you might recognize: Virginia Satir, Carl Whitaker. Cause of problem understood by viewing the role of the family, so the whole family is involved. I don't know if some of you might be aware of that model of the family hero, the family scapegoat, the family clown, and how each person plays a role in the family. You know, that's something that they've seen, and they can use that as a guide to look at one's role in the family and the dysfunction aspect of it. Unresolved emotional fusion to one's family, emotionally detached therapist, teacher, model, coach, here and now, interactions between family members, family mapping, enactments, and reframing. This is a technique that if you're interested in, there's a lot of material out there in these areas, mapping and enactments. Some of the limitations on this is clients lost in the system and language, functional, dysfunctional, stuck in their words in areas that some clients, they don't get that, they don't understand that part of it, and there is more research needed in this area. So the contributions, though neither the individual nor the family are blamed for a particular dysfunction. The family is empowered, so they really incorporate with the family system and try to keep that system as a whole working together. and understanding the individual within a system. There's some theory and just some talk in the field of how important it is to involve the family in the healing process. It's one thing to heal a client or work with a client and get them on their healing journey, go right back into a dysfunctional family system. It's harder for that client to be successful in their recovery process. So the family system is an important aspect of that, and this is primarily why and how this perspective came to be. The integrative perspective together. It does not simply mean picking bits and pieces from theories in a random and fragmented manner. It is important to ask which theories provide a basis for understanding thoughts, feelings, and behaviors. So it's important that if any of these piqued your interest, that you do some research and do some reading and take a look at some of their studies and see, how they came about their theory and developing their perspective. And if it's something that you can relate to, it might be an area that will be beneficial for you in your counseling experience. It is an art to when, where, and why to use a particular intervention, and that is so true. It takes a lot of experience, but it also takes some self-awareness and self-understanding to know when and how to apply some of these theories in certain situations. Because, like I said, some respond to some of this and some don't. Like confrontational approach, there's some that would do well with that. They need that. That's the only way they'll respond. Where others is the opposite. So it's really important that you understand these different types of perspectives. So here's another poll question: which of the theories are you most drawn to? And I apologize for the breakdown in our sound system. But it's a lot of information thrown at you in a short period of time. I understand that. So it's kind of like you're getting water hose thrown at you. Some of the material's a little bit dry, and I get that, but some of it can be interesting. Like I said, it's really an overview. It's important to try to take at some of these theories and see which ones you're most drawn to, because it can enhance your counseling skills and your development and growth as you move through your counseling experience. Some will be helpful right now. Some you might go back to. You'll find you keep going back to certain ones. I personally am drawn more to the person-centered, client-centered approach. That seems to work well with me. While I give the client more of the work, and I'm just more of a guide for them, and they move through their experience that way. So, but I understand how this has evolved through the years, and I understand how now we're looking at a more holistic approach to treatment programs, where they're now looking at the spiritual aspect of things and the emotional side of things, and starting to really look at feelings. It's one thing to look at the mental health of a person and look at the physiological dependence in a client in action, but it's also important to look at their spiritual beliefs, personal beliefs. Take a look at those feelings, unresolved feelings that they're not able to work with or understand how to work with. So it is, and I think it's going to continue to evolve. And as therapists and counselors, we need to be mindful of where it originated at and how it's evolved and why it's evolved through the course of the years. So these are important to look at, are important to understand as you're counseling. So from what it looks, the person-centered approach seems to be common, are the one that most of you want to, which is good. I mean, that's again, it's helpful to understand where you're at and what you understand, because that's going to help you enhance your counseling experience. Any questions? We've gone through a lot of material, We've got about 20 minutes to go here, so we've got a little bit more to go through. So, any questions right offhand? Okay, well, let's just keep moving. If you haven't, you will be. You will be this stage of gauging where a person is in their change process, or where they're willing to change, or where they're at in their change process. And this was developed by Prochaska and De Clementi. And most treatment facilities are using this as part of their assessment tool. You kind of have to have an understanding of what this is about. It has since been used to characterize changes in other addictive disorders where it originated with cigarette smokers in treatment. So De Clementi's cycle of change is we start with the pre-contemplation. And in the pre-contemplation, the person is considering change. They're really unaware that there's even a problem exists. At this point, they're saying it's everybody else's problem and not them. And this is the beginning of the cycle. And then you get to the contemplation. They're a little bit of, yeah, maybe there might be a problem, but, it's not all my fault, or, I'm not the only one and everybody else is doing it, so what's the big deal, or wherever they're at in their, understanding of their addiction. And then the client might come to, they might get to a point of, maybe I do need some help, and they might be determined to make the changes. And that's where developing the plan begins, where they're willing to say, okay, maybe I shouldn't have, did what I did, and I got the DUI, and now it's caused me where I can't get a job here or there or whatever, and they're willing to start taking a look at that and seeing what they're willing to do to make the changes necessary to get healthier. And then the change starts, action, you develop a plan, and they start making the changes, and they see that it's working. What they're doing is working. So the action that they've taken is actually working. And then you have the maintenance part of the cycle of change, and change becomes normal. So they're not afraid of change. They're seeing that by being aware of it and developing the plan and taking the action needed, it's been a positive for them. So the maintenance aspect, it continues. And sometimes life is what it is, and some of our clients relapse and they're back to the beginning. Hopefully, the concept or the phrase that I like is progress, not perfection. When I work with my clients, if they've been repeatedly relapsed frequently, then I usually look at, we do the relapse intervention, and we start taking a look at what prompted the relapse and things like that. And, sometimes they didn't relapse as quick as they did the last time. Or, there was something extenuating that they never dealt with in the beginning of the treatment process. Or, so there's a lot of things that could contribute to the relapse. But their understanding of it, and they're willing to make the changes, and you can go through this cycle again with them, and a lot of times it's easier to move them through this cycle of change than it was in the very beginning in their first experience. So it's a really helpful to use. It's, as you hone in on your skills, your counseling skills, it's a lot easier to see where a client is in that process. So self-disclosure and keeping clear boundaries, this is really important. This is sometimes a deal breaker for some counselors, where understanding where those boundaries are, and I think most of you have to take an ethics course. So a lot of this is disclosed in that ethics course. you're going to learn a lot about this area more, I should say, more in depth. Self-disclosure, sharing personal, emotional, and experiential information. I personally am in recovery, so when I work with my clients, I'm not hesitant to share that. It's really important for counselors when they disclose information. Self-disclosure on the part of the counselor requires careful consideration, and that's really, is it going to help the client? Is what I'm going to share with them going to help the client? Is important in what we're talking about, so it's important to kind of stop and think and check yourself before you engage in self-disclosure. So consider alternatives, and client needs always come first. We're not here to harm. Self-disclosure barriers, like I said, slow down and stop the sharing process if you think it's not beneficial. Client may lose confidence in counselor. So these are just things to think about. Client may move away from self-focus and focus. So it's important to understand, if you're going to disclose anything about yourself, make sure you ask those questions first within. Is this going to help in the healing process for this client? And if you don't think it is, then it's best not to share anything. How often did informal discussion occur? Out of 736 sessions rated with motivational interviewing and such, 42% of all rated sessions, on average, discussions occurred once or twice per session. 68% of counselors had informal discussions 3 or more times in at least one of their sessions. So taking a look at that percentage, it's really important, when we talk about informal discussions with clients, that's something that it's away from the formal therapeutic interaction that you're having with your client. As counselors, it's really important that we're mindful of that. 20% of counselors initiated informal discussions in 75% or more of their sessions. Now, if you think about that, that's a large number of counselors initiating that. Keeping in mind what I brought up earlier, the open-ended questions as opposed to closed-ended questions. You want to really engage your client into sharing more of their information rather than you prompting that information on your part, to hoping to engage them in participating in the session. So be mindful of that as you're disclosing information. It's okay, some people get really uncomfortable with silence. If you're asking the wrong questions and there's a lot of silence, then you're probably you're not asking the right questions, I should say. So take a look at what are open-ended questions. How can I help you? How is the information that we're presenting to you going to be utilized? How are you going to take that? What are you going to do with that? So you get them engaged instead of you sharing all that information. Okay, so how helpful do you think informal conversations are in therapeutic sessions? A little helpful, moderately helpful, very helpful. Some of you might have your own I'm sure you all have your own personal experiences on this. I have found in my early experience that it was helpful, a little helpful, moderately helpful, and in certain areas it can be helpful. But again, when we get into the cultural aspect, I'll share a little bit more on this. So I see that most of you are saying very helpful. Okay, good. Well, as long as you understand your barriers, and as long as you understand it's not hindering the therapeutic process, and it's helping, that's good. Any questions this far? Oh, we have a question or a comment. Okay. Let's keep moving. Okay, cultural and ethnic issues. A key element which enhances opportunity for change. Now you have to understand that most of your clients do not come from one specific ethnic background. And understanding that, if you're in an environment where you're working with a strong cultural base, then you understand that it's important to know, or at least understand, where your clients are coming from. So everything that people have, think, and do as members of a community or society is culture. Material objects, issues, values, attitudes, and behavioral patterns, that's a culture. So our culture is shaped by history, religion, ethnicity, geography, group membership, a subculture. So there's a number of elements involved in what's designing or shaping a culture. The addressing model is, what does it do? It gives us a framework for understanding the effect of diverse cultural influences on therapists and clients. So it helps us recognize the areas where we identify with the dominant group versus the various minority groups. And it helps us become more aware of how identification with dominant groups can limit knowledge and experience of groups we do not identify with. So this is important because knowledge of clients' salient identities gives clues to how clients see the world, what they value, how they may behave in certain situations, and how others treat them. So the more we know, the closer our hypothesis will be to the client's realities. The greater our credibility and the greater our efficiency and accuracy. So understanding a client's culture is huge. Addressing model, the acronyms utilized in this, age and generational influences, developmental disability, disability acquired later in life, religion and spiritual orientation, and ethnic and racial identity, and so forth. So that's the addressing model. Privilege versus oppression. We all have addressing areas of privilege and oppression. We tend to be more aware of areas of oppression. Privileged areas present a greater challenge for therapists. We need to consciously work to increase our awareness about our areas of privilege. Okay, so increasing our awareness, we would investigate our own cultural heritage to start, pay attention to the influence of privilege on our understanding of cultural issues, and work with clients, educate ourselves through diverse sources of information, develop sustained diverse relationships, learn from diverse groups, not simply learn about diverse groups. Okay, I am Native American, so I understand my history, I understand my heritage, my family background, my values, my belief systems, our spiritual belief systems, and things like that. I understand all those, so going into counseling, I can relate quicker to a Native American population than I would to a Hispanic population or Asian population. But that doesn't mean I wouldn't be able to relate to them, but it's just certain areas that I would need to understand their culture to help enhance the counseling experience. Here we have Hispanic Latin Americans, youngest, largest, fastest growing ethnic population in the United States. Hispanic cultural values, they're family-centered values, family ties, friendships, they're very family-based. Spiritual values are hope and faith, gender-based. Communication style, high context. Interventions with Hispanics, awareness of cultural bound syndromes, cultural values, consideration of sociocultural, physical and political circumstances, understanding the role of the family, recognition of the religion, use of indigenous resources, and use of medications. So this is interventions to understand when working with the Hispanic group. Here we have Dr. Mackey. He was instrumental in developing a number of material to help the Native American in the Native American addictions field. he's he was very instrumental in helping Prairie Lands with a number of projects, grants, and such. And we just want to acknowledge him at this point as we introduce the Native American portion of the cultures. There's 565 federally recognized tribes in the United States with 250 different languages. So I think keeping with that in mind, there's not one size fits all for all Native Americans. There's an estimated IHS service population of 2 million. So for the Plains Indians, the Dakota, Lakota, Nakota bands, here's a breakdown of those different bands. My band, my family come from the Teton band, the Miniquoju, those who plant near the water, and that's a Lakota word. The Dakota, Santee bands, Yankton bands. Here's a land transfer from Native Americans to non-Native. In 1775, this was all inhabited by Native Americans. And by 1894, this was what's left of land base for Native Americans. Native Americans' cultural values, harmony with the environment, respect for elders, children are the future, prayers and traditions. So there's individuals are part of a larger system. Everybody has their role in the family's function, camp circle. There's a role for everybody, and it's understood, and it's taught, and it's respected. Intervention with Native Americans, specific socio-political history, the continuing transfer of unresolved trauma and grief across generations. For some of you, you might be familiar with generational trauma. This is an area that has affected a number of our Native people. Socioeconomic conditions, living in poverty, environment, growing up, but being rich in the culture and being rich in family is different. Current and past experiences of racism and oppression, that's ongoing. So understanding the development of interventions in considering that when you're working with Native Americans. Now we have African Americans, great diversity among group members in terms of SCS, educational background, similar historical experiences, cultural traits, and health considerations. Ethno-cultural group whose members identify their ancestry as being invariable linked to Africa. And many prefer the term African American because it acknowledges Africa as an ancestral homeland. And that's important to understand when you're identifying with a ethnic group, what they would prefer to be called. For our Native American, as Lakota people, some don't like the word Sioux Indian. They take offense by that. So being mindful of how you address a cultural, how you address a ethnic group and identify with them. African Americans, total African American population is 39 million, 12.6% of total U.S. population. Their cultural values, strong kinship bonds, communal orientation, strong work ethic, respect for elders, harmony with nature, holistic thinking. So these are important to understand. We're working with the African American population. Some of the interventions with African Americans, mindful of cultural communication styles, aware of the health-related illnesses that disproportionately affect African Americans. One, namely, is diabetes. It seems to affect our Native American people as well. So feelings and experiences with help from mainstream organizations and providers. Now we have Asian Americans, 14.7 million. Huge diversity within this group. We have Chinese, Japanese, and Korean that are identified as Asian American. And then you have Vietnamese, Laotian, Cambodian, and such. So there's a large Asian American population. And here's just a breakdown in where they're typically located. Asian Americans, immigration experience, acculturation experience, cultural values. They are very family bonds and unity. Control over strong emotions, low assertiveness, emphasis on academic achievement. So being mindful of those. The interventions with working with Asian Americans, development and implementation of counseling services, indirect forms of communication, display expertise and authority, providing concrete and tangible advice, waiting until a person is ready to discuss emotional pain. So things to be mindful when working with Asian Americans. So here's some tips for the clinician. Be aware of the many ways of perceiving, understanding, and approaching health, wellness, and healing. Be careful not to misinterpret, stereotype, or otherwise mishandle encounters. Assess the degree of acculturation in the target group you're working with. Seek to become more culturally responsive. Take the risk to discover own biases and stereotypes. Some cultural considerations, tips for becoming culturally responsive. Learn from your mistakes, learn to reframe problems, recognize for counselors, non-native counselors working with non-native counselors, a primary native clientele. We do a training on how to be competent with that particular target group. So there's some out there for here's a summary. So we went through counselor development, the different types of steps that you take. Micro-counseling, talked a little bit about counseling theory, self-disclosure, and keeping clear boundaries, and the cultural issues. This brings us to the close of our presentation. So if you have any questions that you'd like to ask before we sign off, I would be more than happy to answer, clarify any of the information that we went through.
Great, so much.
I appreciate all of you and the work that you're doing in the field. You're in the front lines. You're making a difference. I just want to say thank you for your commitment and your dedication to the field as a fellow colleague. I appreciate you.
Great, thank you so much, Dee. Yeah, we greatly appreciate your perspective and your experience that you brought to this session today. So yeah, as Dee mentioned, please submit any questions, and we will address those before we finish up today. Just quickly, while we are waiting for any questions to come in, I'll go through and remind everyone to look for a follow-up email to come in the next 24 hours. It'll include a link to the recording of this session, and also a link to the survey in case you are not automatically redirected to it and would like to take the survey, as well as a copy of the CEH request form and handouts of this presentation. So again, that will be coming within the next 24 hours. And I'll just put up our upcoming schedule, what we have so far for the next few sessions, both the Essential Interview Skills series and our American Indian and Alaska Native Behavioral Health series. And it looks like we've just gotten comments so far, so I don't see any questions yet at this point. If you do think of questions later, please feel free to get in touch. Either respond to the email that will go out, and we will do our best to respond to those in a timely manner and to give you some more information on anything you might have questions about. So again, I wanted to thank you, Dee, and thank everyone for joining us. And Dee, did you have anything else you wanted to add before we get out?
No, like I said, I am free to answer any questions if anything comes up for anybody else as they process this information. Great. But thank you.
Wonderful. Well, thank you so much, and thank you to everybody for joining us today. And